Hi, I'm Dr. Robert Chao, reporting live from ACR 2021 for Room Now. This is our last day of ACR 2021, and I wanted to share my final highlights in the world of spondyloarthritis with two abstracts. The first one is a very interesting abstract that did not only focus on spondyloarthritis, but I think spondyloarthritis kind of shine in this study. And this was abstract 19.6, which focused on drug monitoring of infliximab treatment in the treatment of autoimmune inflammatory conditions. And they included a very wide array of conditions such as rheumatoid arthritis, psoriatic arthritis, spondyloarthritis, ulcerative colitis, Crohn's disease, and psoriasis. The data altogether did show there was an improvement from the two arms, which was one arm where they dosed and changed the frequency of infliximab on the drug values in the serum. And the second arm where the clinician simply dosed the infliximab based on his clinical judgment. And they found in all of the conditions together, there was improvement in terms of efficacy and no flares from 73% compared to 55%. And when you look at the data in particular for spondyloarthritis, there's a very big gap, 79% to 58%. So I think for me, it does warrant some discussion and some thought the next time I have a patient on infliximab for spondyloarthritis, perhaps getting serum levels will be an appropriate marker compared to our standard treat as per your judgment. And the last abstract is 1730, and I just wanted to wrap up ACR 2021 with a discussion that we see every year in these conferences, which is what do you do with pregnant women who are on biologics for whatever reason? This looked at data from a German registry and looking for disease activity and outcomes in pregnancies of patients with spondyloarthritis. And they found 53% were not on biologics at conception. 38% were exposed to biologics, but not at conception. And only 20% continued biologics during pregnancy. The biologics that they found patients use were primarily TNF inhibitors, with just one patient using an IL-17 and another patient using an IL-12/23 inhibitor. The data is not surprising. They found that moms who used biologics throughout pregnancy had lower flares compared to those who did not. They also did not find any increase in worsening pregnancy outcomes. So I think, this data, we see it over and over again, which I think the old adage rings true, which is healthy mom, healthy baby. And the other thing is, if you look at the data itself again, I think the really puzzling and concerning thing here is only 20% of patients were actually on biologics. So whether or not that is physician hesitancy or patient hesitancy, I don't think we know. But I do think we need to do a better job in making sure patients are adequately treated during pregnancy. So thank you for tuning in for live coverage of ACR 2020. Go to roomnow.com and follow me on Twitter at Dr. RBC. Thanks.